Good morning, everyone. I hope you had a good day yesterday. We have a few items to get through today before we close. Allow me to run through our revised schedule. This morning, we will begin with item 14, Health Workforce, followed by item 15, Progress Reports on Technical Items. Before we break for lunch, we will consider the remaining resolutions. Following this, we will move to item 17, Special Program of Research, Development and Research Training in Human Reproduction, membership of the Policy and Coordination Committee, and then the remaining sub-items under item 16, coordination of the work of the World Health Assembly, the Executive Board, and the Regional Committee, including 16.7. Finally, we will arrive at item 18, time and place of the 75th and 76th sessions of the Regional Committee and the closure of the session. Thank you very much. Okay. So before we begin on the next agenda item, proposed resolutions, also called conference papers, have been uploaded on the Regional Committee web portal. These were prepared by the rapporteurs. We will consider the proposed resolutions, as mentioned, before the lunch break today. We now move to agenda item 14, Health Workforce, document WPR/RC74/@ May I invite Mr. Luis Vinal-Torres, Acting Director, Health Systems and Services, to introduce this item. Mr. Vinal-Torres, you have the floor.
Thank you, Mr. Chairperson. Distinguished representatives, I'm pleased to present the Regional Action Framework on Health Workforce in the Western Pacific region for your consideration. A motivated and competent health workforce in the right numbers, places, and skill mix is central to well-performing and resilient health systems. The Western Pacific region has made significant progress in strengthening the health workforce. Many health workers are being produced and deployed. Many innovations are taking place in the field of human resources for health in our region. COVID-19 exposed, however, many pre-existing vulnerabilities in our health systems, especially the health workforce. It became clearer that there are remaining critical gaps, not only in the numbers, but beyond, in the distribution, quality, performance, and protection of our health workers. Due to considerable challenges during and beyond the pandemic, health workers are becoming more mobile or leaving their professions for better working conditions. Aging populations, the increased burden of non-communicable disease and health emergencies require a health workforce with evolving set of competencies. Under-regulated market forces drive hospital-centric care, leading to inequity and inefficiencies in the system. Managing health workforce issues goes beyond the public sector. The unit of analysis and action is the entire health system. In addition, there are specific contexts to consider in the Pacific Island countries with geographical and resource circumstances. Important technological changes are taking place in how health training and services can get delivered. There is a consensus in the region that a primary health care oriented approach will be the best course for countries to gain progress on universal health coverage. The strategies for health workforce are a critical component in this endeavor. A draft regional framework has been developed to provide guidance for member states to tackle the challenges related to their health workforce. Building, reforming, and realigning the health workforce can take many years. It is a work in progress. Therefore, we must plan strategically and act now. The Regional Committee is invited to consider for endorsement the draft regional framework to shape a health workforce for the future of the Western Pacific. Thank you, Mr. Chair.
Thank you, Mr. Vinal-Torres. I understand the Secretariat has prepared a video on this item. Please play the video. Thank you.
In the Western Pacific, the current health workforce cannot meet the expanding and changing population health needs of the region. There are gaps between what is needed and what is available in terms of health workforce numbers, geographical distribution, skills, productivity, and safety. The COVID-19 pandemic exposed pre-existing vulnerabilities in health systems, many of which are a result of inadequate investments in the health workforce. We must work to protect those who protect us. The regional framework to shape a health workforce for the future of the Western Pacific aims to transform the region's health workforce to be people-centered, culturally sensitive, adaptive, skilled in digital health, and committed to professional development. It outlines actions for aligning health workforce policies to primary healthcare-oriented health systems, increasing funding, improving working conditions, institutionalizing lifelong learning, developing retention strategies, and engaging with the private sector. A health workforce fit for the future ensures that quality health workers are available to everyone, everywhere in the Western Pacific region.
Thank you. We will now hear from representatives who wish to speak on this item. Please indicate you wish to speak by clicking the big button on your microphone. Thank you. I call on the representative of Tuvalu to be followed by Japan.
Thank you, Mr. Chairman. Tuvalu endorsed and strongly supported the regional frameworks to shape a healthy workforce for the future of the Western Pacific. The high attrition rates of health professionals moving from one country to another country is quite obvious and common in the Pacific regions, and it does really have impacts in small island states. Recently, we have lost a majority of our very own locally trained specialists to other neighboring countries. A problem that commonly seen and exists nowadays in the Pacific regions where health professionals move from one country to another. The government of Tuvalu is trying its utmost best to enhance our working environment conditions for our health professionals by moving pay package, perks, and other privilege for our local health professionals with the hope that they will stay longer and serve our people. A retention package is now in the process of development with the ultimate aim to keep and retain our own health professionals in the countries. In addition, apparently the government of Tuvalu is currently working close with donor partners to increase the number of those who we send to training to become qualified health professionals, and at the same time investing more on specialized trainings for health professionals. The rise of burdens of NCD indicates the need for more health professionals in the country to counter and cater for high disease burden. Mr. Chairman, with the shortage of technical and specialized health professionals in some of the small island states in our region, I extend my call for WHO to continue support and offer technical assistance upon request from member states. I thank you, Honorable Chair.
Thank you. I call on the representative of Japan to be followed by Tonga.
Thank you, Chair. Securing both quantity and quality of health workforce is essential for achieving UHC. As this year's G7 presidency, Japan has strongly emphasized this point, and also stated by the leader level at the recent UNGA high-level meeting on UHC. In this regard, Japan would like to thank UPRO Secretariat for its efforts in this framework for health workforce, which is the basis of UHC, and agrees with the content of the draft and the direction of future work. In particular, thank you. We appreciate that this framework contains the importance of continuing professional development. During the COVID-19 pandemic, it was necessary to secure nurses with advanced knowledge and skills in order to respond to the rapid increase of severe patients. We reaffirmed the need to systematically train nurses from ordinal times so that the health system can sustain even in emergency situations. To this end, Japan is promoting to establish a system to enable healthcare professionals to continuously improve their knowledge and skills in cooperation with related organizations. We hope that quality assurance through continuing professional development will be promoted in accordance with the education and licensing systems of each country, and that it will be evaluated by appropriate outcomes. Finally, we recognize that the nursing officer of the UPRO Secretariat, as a temporal position, has made a great effort in the development of this framework. As mentioned within the framework, the nurses account for approximately 70% of the health workforce and are necessary for supporting UHC. In particular, as healthcare needs diversify, nurses play a significant role in providing comprehensive care, including health promotion and disease prevention for all individuals and groups. Since a long-term perspective is essential for human resource development, we believe that a permanent position is needed to ensure that each member country implements its policy of a health workforce based on this framework. The services are stably supplied, and these processes are properly evaluated. For this reason, we expect that the consideration will be given to making the UPRO's nursing officer position a permanent post, similar to other WHO regions, such as AMRO, Euro, and CRO. I thank you.
Thank you. I call on representative of Tonga to be followed by Lao Depierre.
Honorable Chair, Acting RD, Ministers and colleagues. The COVID-19 pandemic unmasked the fragility of health systems and existing inequities, revealing critical areas that require significant improvement, including the health workforce. Irrespective of the development status of a country, all healthcare providers were overstressed and overworked. Many were stigmatized and many lost their lives in the front line. Thus, talking of human resources for health becomes even more important in the post-COVID-19 era. Most importantly, the morale of healthcare providers were affected. Therefore, we must not only strive to have the right skill set at the right place, but also address the present working environment for the healthcare providers. Member states must look at their recognition and appreciation, mental health support, work-life balance, training and skill development, fair compensation and benefits, engage the community of healthcare providers to address their own needs, invest in research on healthcare providers' well-being and burnout to inform evidence and allow for advocacy and policy change. In Tonga, health workers that have been trained are employed by the Public Service Commission upon enrollment and are automatically absorbed into the Ministry of Health upon graduation. The health workforce across the health system and service delivery in Tonga has increased during the recent years. However, we continue to face the challenges related to availability, accessibility, and quality of health workers, especially at the primary care level and remote islands. This is further exacerbated by the recent increasing trend in out-migration due to the global shortage of health workers and aggressive international recruitment. This includes doctors, nurses, and specialists There simply aren't enough to provide a continuum of care or a patient-centered approach. Progress in tackling non-communicable diseases is being outstripped by the rising burden. We need to ensure that our health systems can continue saving lives in the face of future emergencies, whether that's the next pandemic or natural disasters caused by climate change. There can be no health systems without a health workforce, which is committed and has a high morale towards achieving the SDGs. Tonga endorses the draft regional framework to shape a health workforce for the future of the Western Pacific and highly appreciates the commitment and efforts of the Secretariat to produce this framework. Let's build on the momentum of the last 75 years for better health workforce in Tonga, in the region, and in the global arena. I thank you, Chair.
Thank you. I call on the representative of Lao DPR to be followed by USA Territories.
Honorable Chairs, Acting Regional Director Dr. Susan Jacob, distinguished ladies and gentlemen, strengthening the health workforce is the one of top priorities in the health sector reform to achieve the universal health coverage in the Lao People Democratic Republics and under our current 5-year plan. Our experiences during the COVID-19 pandemic close to the pre-existing vulnerabilities of the health system, especially the low investment in health workforce. This lesson taught us clearly that there is no shortcut to increasing the numbers of the competent and qualified health workers, and that clinical capacity within the short period of time, it requires longer and strategic investment. I firmly believe that it is time for the government and development partners to make the bold decision for greater and smarter investment in the health sector for the future. For this, we have been working to finalize the new human resources for health development strategy by 2030. I would like to share 3 key priorities in this strategy. Firstly, we prioritize the strengthening health workforce at the primary healthcare levels to build the sustainable and resilient health system to achieve the USC and SDG goals. At the moment, only 20% of the health centers in the country met the minimum requirements of having 1 physician and 1 nurse and midwife. We want to increase up to 50% by 2025 and 75% by 2030. Secondly, we are confirmed to strengthen the health professional education. To this end, we need more intensified investment for the infrastructure, faculty development, financial support for students, especially for those who from remote areas to continue their study and especially trainings. Lastly, we will improve the workforce distribution and strengthening competencies, motivation, and productivity to maximize the system efficiency. This requires a system approach and stronger governance and mechanism to look at the alignment of the health workforce development with the current and project health needs. Recently, WHO updated the health workforce support and safeguard list. We are now added one of the 55 countries that need priorities, investment, and support. With this area opportunities, we hope that our country can make accelerated progress towards strengthening the health workforce to fit for the purpose and fit for the future. We welcome and support the endorsement of the new WHO Regional Human Resources for Health Framework and enabling platform for member states. For future exchange, prioritize and accelerate our collective effort to invest and protect the health workforce. I thank you.
Thank you. I call on representative of USA Territories to be followed by Brunei Darussalam.
Thank you, Mr. Chair. Hafade Zantiro to you, Acting RD, distinguished delegates, ladies and gentlemen. The United States territories support the regional framework to shape a health workforce for the future of the Western Pacific. Addressing the gaps of a well-performing workforce continues to require an integration of strategies involving training and education, retention efforts, supportive workforce policies, and public health promotion. It is vital for our regional commitments to reflect cross-border collaborative investments in expanding capacity in our territories through training and education programs to ensure a sufficient supply and equitable distribution of healthcare professionals to include doctors, nurses, and all essential healthcare workers. We must continue the hard work to develop, implement, and share policies and incentives to retain healthcare professionals in underserved areas such as our own rural and remote communities, and mirror best practices related to regional healthcare workforce management, with sufficient resources for conducive working environments and fair labor and healthcare practices, with commitments to avoiding brain drain strains that still plague our island communities. We appreciate the ongoing investments made by Wipro to invest in public health campaigns to encourage healthy lifestyles and primary and preventive care. It is imperative relevant research and data are collected and analyzed on health workforce needs and trends to inform evidence-based decisions and resource allocation on more prevention measures aimed at reducing the burden on healthcare workers. Mr. Chair and ladies and gentlemen, American Samoa and absentia, the Commonwealth of the Northern Marianas and Guam support the opportunity to work together to strengthen the health workforce in the Western Pacific and improve healthcare accessibility and quality for our communities to meet unforeseen health emergencies and expanding and future health needs. Mr. Chair, I thank you.
Thank you. I call on representative of Brunei Darussalam to be followed by Cambodia.
Thank you, Honorable Chair, Excellencies, delegates, ladies and gentlemen. Brunei Darussalam thanks the WHO for the drafting of the regional framework to shape a health workforce for the future of the Western Pacific region and applauds its timely development with the involvement of non-health stakeholders, including the academia and human resource experts. COVID-19 uncovered numerous gaps and vulnerabilities in health systems, and in this meeting alone, we have talked about many issues that put additional demands on our health systems. Health workforce is a crucial factor in the equation, and we must evolve and develop innovative approaches to prepare for future demands and improve patient outcomes. In Brunei Darussalam, efforts are underway to review and develop more sustainable and effective way of providing health services, such as the engagement of the private health sector through the outsourcing of services and public-private partnership. The challenge for us is to ensure that the private health sector is effective, efficient, competent, and safe. Health workforce retention is another important challenge faced by many countries. There is a need to strengthen efforts on the training and exchange of health professionals in areas of needs and bring these experiences and best practices back to further develop and enhance their health system and services. While we support the introduction of this framework, we wish to highlight concerns on the implementation of this framework at the national level. First, how do we as a small member state balance in between the urgent need for maintaining minimum standard of service delivery, but at the same time addressing the needs of professionals to further training in countries where the required training is available, at the risk of losing these professionals to the pull factors in the training countries? Secondly, how do we reduce and address disparities in quality, as well as recognition of training equivalence in between and within countries, which can pose difficulties in assessing such qualifications and training programs? Third, we all recognize that member states differ in their capacities and resources to implement this framework. How can WHO assist member states in these areas of need crucial for the implementation of this framework, in particular smaller countries which are competing with bigger countries whose needs are greater but of equal urgency with us, especially on professional regulatory and monitoring, training opportunities, mobility, and maintaining basic services? Ladies and gentlemen, often external stakeholders who are involved with health workforce policies need to be made to understand that evolving and dynamic nature of the health landscape, health education and training, which cannot be generalized with other non-clinical professions, We have the obligation to ensure that our health systems can be sustained and is resilient through a human resource that is adequate, qualified, and highly skilled. I thank you, Mr. Chair.
Thank you. I call on representatives of Cambodia to be followed by the Philippines.
Honorable Chair, Excellencies, ladies and gentlemen, I would like to appreciate the effort by WHO Secretariat in finalizing a draft regional framework to shape a health workforce for the future of the Western Pacific. Like other many countries in the region, we are facing the challenges of shortage of quality health workforce, particularly in rural areas. The lack of human resources, limited diagnostic capacity, insufficient supply of medicine resulting in low utilization of public health facility. That is why the Pentagonal Strategy Phase 1 of the new Royal Government of Cambodia has prioritized on quality healthcare services and regulated private health facility to be complemented partners of public health facility to reach our UHC by 2030. This action framework is aligned with the development and finalization of Cambodia Health Workforce Development Plan 2023-2030. Cambodia also reinforced the implementation of law and regulation of health professionals, including registration, licensing, and relicensing for practice by providing mechanism for ensuring that all health practitioners are qualified, competent, and fit to safely practice their profession. Reflecting to the regional framework, challenge to be considered is dual practices of health professionals for our region. Additionally, in collaboration with WHO, we are reforming pre-services education system for health professionals, focusing on competency-based curriculum. Simultaneously, we are enhancing the capacity of regional training center through training of trainers. This measurement will contribute to establishing future generation of our health professionals and improve quality of care and health outcome. A well-performing health workforce is central to a resilient health system. Cambodia welcomed the new regional framework on health workforce and expected it would guide us to better future. Cambodia also welcome and support of a region for capacity building of health workforce. I thank you very much for your kind attention.
Thank you. I call on the representative of Philippines to be followed by Fiji.
Thank you, Mr. Chairperson. The Philippines endorses and fully supports the regional framework to shape a health future of the workforce for the future of the Western Pacific and beyond the Western Pacific. The global relevance of the work is linked with international mobility of the health workforce we have seen, especially during the COVID-19 pandemic. We share the vision of a future workforce. We have the 5 key strategy areas for action in the framework are aligned with the country's National Human Resources for Health Master Plan 2020-2040 with the goals of adequacy, competence, decent work, and motivated health workforce to support the attainment of universal health care. The attainment of these shared aspirations also underscores the need to strengthen health workforce leadership and governance in member states. Further, recognizing the crucial issue of migration in addressing the global HRH gaps, it is timely to revisit the international instruments such as the WHO Global Code of Practice on International Recruitment of Health Personnel to be more responsive to the source needs, country needs, and perspectives. This creates the demand for WHO to support enhancing member states' capacities to promote adoption of the principles, improve transparency and monitoring of agreements, and to optimize the gains of their health systems. Finally, highlighting the health workforce as a crucial pillar in sustaining health systems, we emphasize the value of collaborative and coordinated actions amongst member states in the region and globally in pushing for sustained investments in programs for health workforce and their welfare. Thank you.
Thank you. I call on representatives of Fiji to be followed by Mongolia.
Honorable Chairperson, Acting Regional Director, honorable members of the forum. Fiji acknowledges and thanks the Secretariat for the draft regional framework to shape a workforce for the future of the Western Pacific. It is a timely one indeed for the region. We fully support the region's heightened focus on health workforce and agree that investing in the health workforce has many positive impact on our healthcare workers' families and their communities, gender equity, protection against poverty, and economic growth. For Fiji, despite the economic challenges faced during COVID years, the government decided not to reduce or stop the payment of salaries for healthcare workers and indeed for the more than 35,000 civil servants in the country. This decision ensured that civil servants were able to support their families, extended families, and their local communities as other sectors curtailed the working hours of their workers or sent workers home. One of the first actions of the new coalition government in Fiji earlier this year was to revert the retirement age back to 60 years for civil servants, including the health ministry's workforce. This policy decision immediately meant that we will be able to retain the cohorts of our senior and experienced healthcare workers who would have been retired under the old policy from 2023 to 2027. The 5 key strategic actions of the draft framework are wide-ranging and robust to be able to address our regional and national need for people-centered, skilled, motivated, safe, adaptive, and healthy health workforce. We look forward to working with the support of WHO and our partners to address issues of workforce development planning, capacity building, and distribution, as well linking this to our new primary healthcare approach. Keeping our health workforce healthy is also an important target given the investment made for professional development. Our wellness program has strengthened the healthy workplace setting program in the public and private sectors, which involves weekly Wednesday wellness physical activity programs, regular health and weight checks, and pharmaceutical and non-pharmaceutical interventions. To conclude, Fiji fully supports the draft regional framework and calls on WHO and health partners to assist Fiji and member states under the framework to build up and strengthen our health workforce who will be able to tackle our disease burdens and facilitate our achieving universal health coverage for our people. I thank you.
Thank you. I call on representatives of Mongolia to be followed by New Zealand.
Thank you, Mr. Chair. Dr. Yakab, ARD, Honorable Ministers of Health, distinguished delegates, ladies and gentlemen. Mongolia highly appreciates the work of the Secretariat for developing and submitting this draft regional framework on health workforce for this regional committee's consideration. We believe that the current draft regional framework will complement the global strategy on human resources for health, Workforce 2030, as well as the other strategic frameworks applicable to our region and guide us in our works towards tackling long-term challenges of human resources for health, resulting in significant progress towards achieving the UHC, as well as better protecting health workers in the longer run. Ladies and gentlemen, it is estimated that NCDs are accountable for 83% of total deaths in Mongolia, according to the WHO's NCD Progress Monitor 2022. The burden of NCDs and chronic non-communicable conditions combined with the aging population require greater needs for health services. As of 2022, Mongolia's total population was 3.4 million, and a total of 63,000 health workers are employed in the healthcare sector of the country. Of these, almost 82% are women, and the largest share is employed by the public sector. In terms of health workforce density, there are 189 health workers per 10,000 people, which is highest in the world. And the SDG indicator on UHC service coverage is 67.1 as of 2022. As one can see, Mongolia does not have any gaps in terms of numbers of health workers. However, within the country, they are inequitably distributed geographically. Specifically, we have a shortage of skilled health workers in remote rural areas. This maldistribution is contributed by a number of factors, including in-country mobility to urban areas, migration to high-income countries seeking better employment opportunities and living conditions, among others. In order to attract and retain the health workforce in rural areas, the government has taken incentive measures over the past 15 years, including provision of housing opportunities, added benefits of longer annual leave days, and wage increases based on geographical distance and remoteness from the urban centers. However, gaps and challenges continue to exist between urban and rural health workers in terms of numbers and skill mix. And these already existing challenges have been exacerbated by the COVID-19 pandemic, leading to increase in the number of health workers leaving their professions due to burnout, anxiety, and stress. Mr. Chair, having said above, Mongolia would like to iterate our support in adopting the draft regional framework to shape a health workforce for the future of the Western Pacific under the overall guidance of the For the Future vision and other strategic frameworks of the Western Pacific region. And I thank you for your attention.
Thank you. I call on representatives of New Zealand to be followed by the United States.
Thank you, Mr. Chairman. Tēnā koutou katoa. Aotearoa New Zealand endorses the draft regional framework to shape a health workforce for the future of the Western Pacific. Given the workforce is the backbone of a health system, we are pleased to see the draft framework underpins other frameworks recently endorsed by Western Pacific member states, including frameworks on NCD prevention, primary health care, reaching the unreached, and mental health. We agree with the 5 strategic actions identified in the framework that identify fundamental priorities for action and reflect the need to take a systems approach. The draft regional framework is well aligned to the key characteristics of New Zealand's health workforce strategic framework, and we are already underway implementing our national workforce action plan. In Aotearoa New Zealand, we have made some positive gains in our workforce system. It has enabled high quality clinical skills and capability across the professions that are essential to the delivery of health services. Most recently, we have seen an increase in our vaccinated workforce and Māori Kaiawhina workforce to help families and whānau navigate the complexities of our health system to access appropriate and culturally responsive health services. However, like other member states, we face significant workforce challenges requiring immediate action and more fundamental change. Some challenges include workforce shortages, maldistribution, and a workforce not representative of the New Zealand population. The underrepresentation of Māori, disabled, and Pacific peoples, coupled with variable cultural and disability competency across our workforces, limits the ability to meet the needs of our most vulnerable populations. Addressing these challenges and prioritising action is articulated in our recently released New Zealand Health Strategy and Pai 2, our Māori Health Strategy. Meeting the future needs of our workforce system requires change across a suite of levers and in tandem. For example, it will not be enough to grow capacity in our education and training system without improving retention rates and employment, or take short-term solutions to address workforce shortages without addressing more complex underlying issues. Our workforce needs to feel valued, safe, and supported to deliver the health services our communities need when they need them and in the places they live and belong. Developing a whole-of-health workforce approach increase coherence and alignment of goals. We continue to collaborate closely with our Pacific neighbours and have made bilateral investments in health workforce development, such as designing a workforce twinning program and providing supportive supervision of healthcare workers. Chair, we have a way to go to make meaningful change and look forward to understanding how fellow member states will utilise this framework as we collectively work to meet our own government's health workforce needs and the goals of the Western Pacific region to be the healthiest and safest in the world. Ngā mihi nui, thank you.
Thank you. I call on the representatives of United States of America to be followed by Samoa.
Thank you, Mr. Chair. The United States supports the draft regional framework to shape a health workforce for the future of the Western Pacific. We are encouraged by the continued focus of WHO on the health workforce in achievement of the Sustainable Development Goals, which will not be possible without addressing the global 10 million health workforce shortfall that severely impacts the Western Pacific region. Recognizing that the COVID-19 pandemic exposed further vulnerabilities in the region's health systems, there is an urgent need to address health workforce gaps to sufficiently meet the health and unforeseen health emergency challenges in the region. We appreciate that the draft regional framework will support implementation of other recently endorsed regional frameworks to meet health needs in the region, including those on non-communicable disease prevention and control, primary health care, reaching the unreached, cervical cancer, and mental health. We applaud the framework's focus on investing in the health workforce to accelerate economic growth with focus on gender equity and decent work. Equipping the health workforce to meet expanding and future health needs, including for aging populations. Protection and safeguarding of the health workforce, including from gender-based violence. Attention to equitable employment practices and collective efforts toward the WHO Global on the international recruitment of health personnel. This aligns with United States priorities within the White House Global Health Worker Initiative, including advancement of support and protection of health workers, expanding decent work and equitable health worker employment, developing a more diverse workforce that is better representative of the population it aims to serve, and expanding use of technology for health workers. Thank you, Mr. Chair.
Thank you. I call on the representative of Samoa to be followed by Vietnam.
Thank you, Mr. Chairman. Good morning and talofa. Samoa approached our regional office for developing the draft regional framework to shape a health workforce for the future of Western Pacific, which will guide our regional and national efforts in building a strong and sustainable health workforce to provide people-focused health services for our population. We are fully aware health workforce is the most valuable assets in our health systems. Without them, our health systems cannot function well, and our expected health outcomes cannot be achieved. Hence, it is very important for us to prioritize our health workforce developments to ensure that we have devoted health workforces with required aptitudes to assist in providing people-centered health services for our people and achieving our commitments to our regional and national health priorities, as well as health-related sustainable development goals and universal health coverage. Samoa remains committed in developing its health workforce through provision of capacity, building trainings to build the capacity of its health workforce in different areas of health services to ensure they are well equipped with required knowledge and expertise to deliver safe and quality health services through scholarship schemes by Samoa government, Australia, TFAC, and New Zealand, MFAC, as well as WHO fellowship program, and develop and implement national human resources for health strategy and Samoa health workforce development plan to address health workforce issues arise from time to time, and assist with identification, of health workforce needs that needs to be acknowledged and actioned. Even though we are facing challenges of losing health workforce due to New Zealand and Australia quota schemes and seasonal worker scheme, but we managed to formulate internal control measures to control the migration of health workers overseas, such as strengthening health bonding system. To conclude, Samoa fully supports the recommendation to endorse the draft regional framework to shape a health workforce for the future of the Western Pacific, and will continue to formulate and implement interventions to control health workforce turnover and retain further development of the existing health workforce. Just to finish up, Mr. Chairman, on behalf of the delegation of Samoa, since this is our last day, we voice our thank you very much to the regional director and also your chairman and the regional committee and also the regional office for the great work that you have done this week. And also we thank the delegation of Samoa. Would also like to extremely thank the government of and people of Philippines for warm hospitality accorded to us since our arrival here at this time. We would also like to extend our deepest gratitude to the management and staff of WHO Western Pacific Region Office for the excellent arrangement made for this meeting. We are pleased to be here in person to attend this very important meeting that provides the collective voice of the Western Pacific region. We wish everyone an enjoyable and successful meeting. Also, we, delegation from Samoa, once again congratulate the new RT elected, and may the Lord and His blessing be upon you and the family for your new role. So when we depart and we finish today, so may God guide you in the homes and your lands. Thank you very much.
Thank you, Samoa. I call on representative of China to be followed by Vietnam, please.
Thank you. 尊敬的主席先生，我们特别
Thank you, Honorable Chairperson. We thank the Secretariat for the report. China applauds WHO's unremitting efforts for health workforce development in the region and welcomes the draft regional framework to shape a health workforce for the future of the Western Pacific. China pays high attention to health workforce development, and we focus on the development of a resilient workforce with integrity, and we try our best to complete PHR workforce, and we prioritize our workforce development in rural areas and enhance workforce capacities and establish education system that is targeted for future workforce. We try to expand the mandate of health professionals, including health workers for elderly care and community services. We innovate human resources management, promote the establishment of practice-oriented evaluation systems, knowledge-based, value-based compensation systems, task-based allocation mechanisms, and provide care and support to health workers. Finally, China is willing to participate in the process, and we support the adoption of the resolution. Thank you.
Thank you. I call on representative of Vietnam to be followed by Cook Islands.
Thank you, Chair and Cynthia. Having a fit for purpose health workforce is one of the important drives of the health system. We appreciate WHO's development of the global strategy on human resources for health workforce 2030, and now development of the regional framework to shape a health workforce for the future of the Western Pacific. Health workforce development has been prioritized by the Vietnamese government with the current development of the health workforce strategies that focuses on developing human resources for health in terms of quality, quantity, and equitable distribution. Early this year, the National Assembly approved the revision of the law on examination and treatment, which serves as a health service law. This revised Law provides the legal framework for the establishment of the National Medical Council and introduction of a national licensing examination for several health professionals. Vietnam recognized the need for the regional framework to shape a health workforce for the future of the Western Pacific to support WHO member states to develop their policy and to address their health workforce challenges in education, employment, retention, distribution, and performance to better meet the changing health needs now and in the future. Thank you, Chair.
Thank you. I call on representatives of Cook Islands to be followed by Republic of Korea.
Kia ora ana tātou katoa. A warm Pacific greetings and a very good morning to all of us. The global challenges to the limited number of available health workforce and recruitment in small island states provide a significant risk to our health system. Coming out of COVID-19, where our workforce is already stretched and burnt out, it's the biggest problem and challenge to managing our workforce to continue to maintain the delivery of healthcare services to our people. I know we have taken on expatriate staff from our Pacific neighbors and from other countries, and at the same time losing them abroad where their contracts have expired. For this reason, though it may be a reactive approach to addressing our workforce challenges, the Cook Islands have embarked on a strategy to growing our own workforce. Our first cohort of nurses, a Pacifica nursing degree program with Whitireia Polytechnic of New Zealand, in collaboration with WHO and SPC, will be completing their study next year and to join the workforce by end of 2024. We are now in the process of taking on our second cohort for 2024. And our plan is by 2028, we hope to recruit 50 to 60 nurses. And secondly, we have explored in-country training for our doctors and midwifery nursing. We are very grateful to the Fiji National University for supporting this in-country capacity development initiatives that our health staff can remain in-country and continue with their learning pathways. The 15th Pacific Health Ministers meeting committed to rethinking human resources for health and the development of this regional framework to shape a health workforce for the future of the Western Pacific. It's very important. Therefore, the Cook Islands gives its full support to this, for this to be endorsed. Unlike other professions, there is no shortcut to training health professionals. Staff retention strategies is now at the forefront of our staff management plans to ensure that we maintain current numbers while we continue to recruit key specialists. Establishing a mobile group of health experts, specialists could be a solution in the short to medium term to supplement workforce needs in the region, either by virtual access or by in-person presence. During our COVID-19 response, we employed a whole of sector and whole society approach as a national effort to overcome the pandemic. This remains as a possible solution should we reach a critical level of shortage to our health workforce. As we say, together we can. To our development partners, I thank you all for the support accorded to the Cook Islands over the years. I thank you, Chair. Meitaki.
Thank you. I call on representatives of Republic of Korea to be followed by Palau.
Thank you for giving me the floor. Good morning, Honorable Chairperson, Acting Ali, distinguished ministers, delegates, ladies and gentlemen. The Republic of Korea strongly supports the issue of enhancing the quality and quantity of health workforce and the actions recommended for in the report. We recognize it is essential for achieving our ultimate goal of universal health coverage that we nurture enough number of better trained, capable health workers and distribute them evenly. The Korean government also puts a stress on the expansion of essential health workforce as the top priority for innovating the health system after the COVID-19 pandemic. We are arranging measures to improve the working conditions for health workers in order to secure enough number of them and to minimize the workforce gap among different fields. Also, as there is an issue of disparity in the number of workers among regions in RK, we are trying to come up with measures to address labor shortages in rural areas and the disparity in the distribution of workers. As such, we look forward to an opportunity to share the draft of the regional framework with our regional member states and continuously discuss each country's experiences and cases. The needs of the residents will become complex as the health environment changes going forward, and therefore the professional workforce that provides the service must change too. As the report mentioned, the increase in the number of elderly population, growing burdens of NCDs, and the highlighted importance of primary medicine in the process of preventing and treating them, relieving the gaps in accessibility to services among regions, rising demand for mental health, etc., are being experienced by not only the Korean government, but also all the other member states. And we consider those changes are what we should be prepared for. As such, the RK fully supports the draft of the regional framework proposed in the report and looks forward to joining the effort for achieving the goal effectively with the countries in the region sharing experiences and actively participating. I thank you.
Thank you. I call on representatives of Palau to be followed by Kiribati.
Thank you and good morning, Honorable Chair, Acting RD, Honorable Ministers, distinguished delegates. As we all can attest to, the challenge of maintaining a sufficient, healthy, competent and resilient health workforce is not limited to our region, but continues to be a worsening global crisis. Not only are we competing amongst ourselves, recruiting from a diminishing pool of health professionals, we're also competing with other public agencies, civil society, and the private sector for the very same workforce. It is therefore imperative that we approach this crisis with a multi-sectoral whole-of-government strategy that realizes and accounts for necessary action steps that health ministries cannot take on its own. As such, we need to expand our base of partners and stakeholders if we truly want to effectively address the personnel shortage. In Palau, we are working with our civil service and finance ministries to revise public service regulations and government salary scales to allow us more streamlined and competitive recruitment and incentivizing retention of critical personnel, especially nurses and qualified public health professionals. We're also working with partners, including the WHO, US CDC, and the Pacific Island Health Officers Association, PIHOA, to establish baseline human resource data, identify workforce gaps and training needs, and develop subsequent career pathway and professional development initiatives to address the health workforce crisis. For the region, we recommend that we employ more innovative strategies such as establishing region-wide equivalency standards for public health and clinical personnel that would allow us to expedite resource sharing in the region to assist those with emergency workforce needs. We should also seek to leverage funding support for regional public health and medical academic institutions, as well as establish regional health scholarships to ensure a sustainable pipeline of competent and qualified health professionals fit for purpose for our region. So with this, Chair, the Republic of Palau endorses and appreciates the regional framework to shape a health workforce for the future of the Western Pacific, which we believe sets a strong foundation for the region and individual member states to effectively assess and address current and anticipated health workforce needs. Thank you, Chair.
Thank you. I call on the representatives of Kiribati to be followed by Malaysia.
Honorable Chair, Acting RD, Honorable Ministers and Delegates, ladies and gentlemen. Maori and greetings to you all. Kiribati endorses the regional framework to shape a health workforce for the future of the Western Pacific. And we thank the WHO Repro team for putting together this very comprehensive document. We commend the action framework for articulating a clear vision for what a fit-for-purpose future health workforce for the region should look like. We note that the attributes for a fit-for-purpose future health workforce listed in the framework take into account many of the important matters discussed over the course of this week. For example, yesterday we discussed the importance of preparedness and resiliency for disasters and health emergencies. We also deliberated on the need to embrace innovation and the important role of digital solutions in the health sector. These, amongst other important attributes, are both reflected as attributes of a fit-for-purpose future health workforce in the action framework. For member states' better understanding of the framework, we commend efforts by the Secretariat to summarize and simplify the action framework by presenting the analytical framework in Chapter 2 of the document, which we find very helpful. Though called the analytical framework, it looks to us more like the theory of change for this action framework, depicting the stepwise prerequisites for achieving a fit-for-purpose future health workforce for the region. Ladies and gentlemen, the bottlenecks for achieving a fit-for-purpose future health workforce listed in the documents are issues we are all very familiar with. However, the extent and magnitude of these issues are far worse in my under-resourced small island country. As highlighted on page 21 of the action framework, Kiribati is one of the 8 countries in the Western Pacific region facing the most pressing health workforce challenges, and thus requiring concerted investments and support. Despite our health workforce challenges, we have been making progress, as highlighted also in this framework, and we have success stories noteworthy of sharing. Kiribati was the first Pacific Island country to send students to study medicine in Cuba. To ensure our foreign-trained medical graduates were fit for purpose for our Pacific context, we established a medical internship training program that also benefited Nauru and Tuvalu. With our Cuban medical graduates, the majority of whom are females, we have been able to more than double our medical workforce numbers. An increasing number of our Cuban-trained doctors have successfully completed postgraduate training and are serving as medical specialists, not only in my country, but also in other Pacific Island countries. We also have health workforce innovations, which will enhance primary health care being planned. Honorable Chair, Kiribati looks forward to working with WHO and our generous brothers and sisters from the larger countries in this region to support us operationalize and implement this action framework. Thank you.
Thank you. I call on the representatives of Malaysia to be followed by the Federated States of Micronesia.
Thank you, Mr. Chair. As her health workforce is the heart and most costly resource in the health system, effective management and planning of the health workforce is of utmost importance for the delivery of high-quality healthcare services for the nation. Like other member states, Malaysia is facing challenges in managing the health workforce, including shortages of certain healthcare worker cadre, inequitable distribution, migration, imbalance of supply and demand, uncoordinated data, as well as limited capacity for effective planning of the resource. Malaysia always strives to improve the country's health system, including the management of human resource for health. On June 2023, Malaysian Parliament approved the health white paper to guide the country's health reform initiatives for the next 15 years. The health white paper strategies are in parallel with the direction of this framework, which also focus on prioritizing primary health care, improving intersectoral coordination and collaboration, as well as fortifying the health workforce. In achieving the targets of Sustainable Development Goals and universal health coverage, Malaysia also upholds the Global Strategy on Human Resources for Health Workforce 2030. Ongoing efforts to strengthen the overall health labor market, including reforms of the policies and legislations with regards to health workforce ecosystem, is in the pipeline of Malaysia. We strongly believe that evidence-based and structural reforms in the policies on production and education in health, as well as policies on health labor market dynamics, are foundation for sustainable and future-proof health workforce. The draft framework has aptly highlighted health workforce challenges in the region and outlined strategies in addressing those challenges. We are glad that WHO is moving forward to provide more assistance and technical support to member states, particularly in enhancing capacity for managing health workforce and leadership, as articulated in the last chapter of the framework. Hence, Malaysia supports the endorsement of this draft regional framework to shape a health workforce for the future of the Western Pacific, to reinforce the health workforce in the region, to provide a better and broader health services for the population well-being. With that, thank you, Chair.
Thank you. I call on the representatives of the Federated States of Micronesia to be followed by Papua New Guinea.
Thank you, Honorable Chair. Federated States of Micronesia welcomes and appreciates the report. The COVID-19 pandemic further worsens the shortage and lack of critically needed skills in our workforce. We must find innovative ways and means to respond to this shortage. With respect to increasing the pool, the report should also note and incorporate the important role of building the foundations in science, technology, engineering, and mathematics, STEM. We appreciate the support from WHO and partners in the development of our workforce and training opportunities. Our appreciation also goes to the government of the Philippines for lifting the ban that complicates our ability to hiring critically needed skilled personnel, an arrangement we firmly believe brings mutual benefits. We endorse the draft regional framework. Thank you.
Thank you. I call on the representatives of Papua New Guinea to be followed by Australia.
Thank you, Honorable Chair, Acting RD, distinguished guests, ladies and gentlemen. Papua New Guinea acknowledges the support of the WHO for its ongoing assistance provided in the region and development of this draft regional framework. Investing in health is one of the key health agenda of the government of PNG as it strives towards the progressive attainment of the key result areas in the country's National Health Plan 2021-2030, Sustainable Development Goals, and the universal health coverage. However, the realization of this goal is linked with having an adequate and well-trained workforce who are equitably distributed, motivated, and supported to perform optimally. The health workforce is charged a critical health system input as they design, manage the system, and deliver health services as required. In order to create responsive and active policies to optimize access to health services and unlock economic benefits of health workforce investments, it is essential to understand the dynamic and challenges that health labor markets faces. A comprehensive and integrated analysis of the recruitment, distribution, retention, productivity, and financing of the health workforce. Efforts geared towards improving access to health services and strengthening of the primary health care through community engagement requires strategic investments in a competent and committed health workforce of appropriate skills and in adequate numbers. As a country, other ongoing efforts like Village Health Assistance Program, Health Workforce Information Update, and workload analysis using the workload indicator of staffing needs were conducted in 2019 work on the health force accounts and health labor market analysis commenced in 2021 and 2022 in PNG. Efforts are ongoing by our government to deal with the health workforce issues currently confronting us. With support and partners at national, regional, internationally, especially through WHO network, we will improve our current status quo. We all know that health is wealth and health is labor intensive. We cannot move the health sector without the right number of health workers at the right place doing the right things. Recruitment and engagement of workforce is one thing. However, training and producing the right number and fit for purpose workforce should and must be a priority for the Western Pacific region. Therefore, PNG welcomes and endorses the draft regional framework on the health workforce. I thank you, Chairman.
Thank you. I call on the representative of Australia.
Thank you, Chair. It's important we continue to address the key gaps and challenges in the Western Pacific region to ensure future workforce that is inclusive, adaptive, agile, high-performing and safe. Australia is working hard to address our health workforce challenges by increasing the availability of domestically trained health workforce. In primary care and regional Australia, we are better leveraging the skills of healthcare workers to optimise patient outcomes, increasing the number of health professionals, particularly in rural and remote Australia, improving and embedding digital health systems and digital healthcare to improve care delivery, and improving health outcomes for First Nations people, and improving patient access to healthcare, in particularly primary care for all Australians. Australia is developing a national nursing workforce strategy informed by the WHO Global Code of Practice on the international recruitment of health personnel. The strategy will support the ongoing development of the profession now and into the future to meet the healthcare needs of the Australian community. Our tailored national workforce programs include training and initiatives designed to increase the capability and capacity of the health workforce, including nursing. The initiatives also increase recruitment and retention of nurses and specialist medical trainees in rural, regional, and remote areas. We are also providing support for Pacific regional health workforce programs, which aim to enhance in-country education and training, including through supporting clinical capacity building and leadership development and coordination of deployments of multidisciplinary visiting medical teams in the Pacific. We reaffirm our continued commitment to partnering with Pacific countries and regional institutions to help tackle health workforce challenges. Finally, we support the draft regional framework to shape a healthy workforce for the future of the Western Pacific. Strategic actions align with those of our health workforce strategy. We also appreciate that the framework recognises the importance of a diverse, inclusive workforce and reflects the importance of policy actions to address gender inequality. We look forward to working with our Western Pacific neighbours through our strong relationships on progress towards UHC. Thank you.
Thank you. Are there any more representatives who wish to speak on this topic? If not, I understand that there are representatives of non-state actors who wish to make a statement to the committee on this agenda item. Both written and oral statements will be uploaded to the designated RCM webpage and the meeting app. As statements reflect solely the views of the NGOs concerned, it follows that statements do not necessarily reflect the views of WHO, including its member states and secretariat. It is my pleasure to call on the representatives of NCD Alliance, together with the International Alliance of Patients Organizations, to deliver a short constituency statement to the Regional Committee, to be followed by the representative delivering another constituency statement from the International Federation of Medical Students Association and the International Pharmaceutical Students Federation. Thank you.
Good morning, Mr. Chair. Thank you very much. The NCD Alliance, the Healthy Philippines Alliance, and the International Association of Patients Organizations support the draft regional framework to shape a health workforce for the future. We firmly believe that a robust primary care-oriented healthcare workforce is central to the attainment of UHC. As the front line of the health system and the key resource for community outreach, Furthermore, a skilled and deployed health workforce can optimize the care and management of NCDs, a critical enabler to also achieve UHC and the realization of global health targets enshrined in the SDGs. We urge member states to officially endorse the draft regional action framework to shape a health workforce with the following recommendations for consideration. First, enhance multi-sectoral collaboration to strengthen the health workforce. The responsibility for NCD prevention and care does not lie within the health sector alone, but also involves other sectors and partners. A multi-stakeholder collaboration is a winning approach to identify and scale up tailored health workforce solutions. Multi-sectoral partnerships are a powerful tool to optimize the health workforce. Second, put in place a regulatory framework for the development, deployment, and retention of human resources for health. A regulatory framework tailored to the current context and to HRH needs at primary care level is a crucial enabler to optimize the health workforce. It should include guidelines for the recruitment, training, accreditation, deployment, and retention of HRH. Third, leverage multidisciplinary care teams with a robust role for community health workers to deliver primary health care for NCDs. Reorienting health systems towards a collaborative primary care approach has potential to better align with population needs while improving cost effectiveness. This approach encourages optimal collaboration and contribution of different typologies of health workers, including community health workers. It represents a promising way forward to increase community member trust in the health system, provide prevention and health promotion services, NCD screenings, and ongoing NCD care and management. Finally, carefully design and implement digital tools to enhance the capacity and reach of the health workforce and ensure equitable access to health services. Digital health technologies have the potential to play a beneficial role in the treatments of NCDs, helping CHWs address gaps in healthcare access in low-resource settings and improve service delivery efficiency. However, to enhance health services access and quality, factors including socioeconomic status, gender, age must be considered from the design stage. Thank you very much for listening.
Thank you. I call on the representatives of International Federation of Medical Students Associations and the International Pharmaceutical Students Federation.
Thank you and good morning, Chair, Acting RD, and distinguished delegates. The quality and effectiveness of health services are defined by the individuals who deliver them. The health workforce is the cornerstone of health systems, exerting a significant impact on health equity and outcomes in local, national, regional, and global settings. The International Federation of Medical Students Associations and the International Pharmaceutical Students Federation together represent over 2 million future healthcare workers from over 100 countries across the globe. With the WHO's projected shortage of 10 million health workers by 2030, we firmly believe in the rights of health workers to a decent and safe working environment, employment rights, social protection, and engagement in decision-making. IFMSA and IPSF acknowledge the collective efforts by the WHO and member states in supporting and safeguarding the healthcare personnel, especially in vulnerable communities. Despite improvements to working conditions of the health workforce, there are still opportunities for development concerning availability, accessibility, quality, and socioeconomic environment for jobs in the health sector. We emphasize integrating interprofessional collaboration initiatives within the health workforce is paramount in addressing the multifaceted challenges faced by healthcare systems. By fostering collaboration among healthcare professionals from diverse backgrounds, such as doctors, nurses, pharmacists, and social workers, we can enhance the quality of patient care, improve healthcare outcomes, and optimize resource utilization. Collaborative practice also cultivates a culture of mutual respect, understanding, and trust among healthcare providers, which is fundamental in building a resilient and responsive health workforce. We call on the WHO and its member states to improve the availability and accessibility of health workers by incentivizing the collection and analysis of data on human resources for health, such as needs, supply, and demand. By evidence-based approach, long-term strategies and stewardship for the health workforce are needed to engage stakeholders such as ministries of health, education, public and private sectors, professional and international organizations, NGOs, development partners, labor unions, and civil societies. We also urge member states to consider the health workforce within health financing, where at least 5% of the domestic GDP should be invested in health, with prioritization of education, training, accreditation, quality assurance, and remuneration for health workers at all levels of the healthcare system. Following capacity building in the health workforce, there is a need to strengthen employment generation, including conversion of informal or unpaid work into formal and decent jobs, and making the WHO Global Code of Practice for International Recruitment of Health Personnel a core component in response to retaining trained personnel. As the largest organizations that represent medical and pharmaceutical students worldwide, IFMSA and IPSF are committed to improving global health and supporting the health workforce as future healthcare professionals. Through intergenerational partnership and meaningful youth engagement, we demonstrate our unwavering dedication to achieving health for all. Thank you for your attention.
Thank you. May I now call on the Secretariat to respond to the points that have been made? Mr. Witt.
Thank you, Mr. Chairperson. First of all, I would like to thank you on behalf of the Secretariat for all the positive and supportive interventions that we have here early this morning. First point that we would like also to make is that there is a collective recognition of that HRH issue will stay, and that we have to recognize it, that will be a priority in the next decade. And we really welcome the focus and the priority and importance given to the topic. We take note and welcome the priorities lined out in most of interventions in the three main domains: production. There is an interest and also recognition that production will not be enough, that we really need to first also consider production of which type of workers we will need to shape, particularly systems that should be based on primary health care, but also moving quickly to the management of the health workers that will be produced. The second priority that we note and also welcome is the importance given to the regulation and the use of this policy lever to steer the public policy goals. The third one is migration and retention. The fact that we have to collectively use all the capacities and policy levers in our domains to steer to. We have heard and we share the concern of how to manage rural retention of health workers in remote areas, and also management of international migration. On the implementation side, I think we would like to highlight there is a need to collectively strengthen the stewardship of the HRH issues at country levels. There is a need to recognize that we have to go beyond the management of civil servants of only the public sector, and there is a need to go to have as we said, the unit of analysis, the entire system, basically including also the private sector. This will require, as was noted, going beyond the Ministry of Health and engage all the stakeholders that have a stake on the management on human resources for health. And the Secretary, will be very happy to contribute to this dialogue. The last point is the call that we also heard on regional collaboration. There is a lot of wealth of experience happening in country, and this has to be put in value. It's our job as Secretariat to use to be used as a platform for this to be facilitated, and all the learnings and experiences that are happening at country to be shared and to help member states and stimulate changes at country. Lastly, we note also the point on asking to strengthen the team in the regional office to work on human resources for health, and we really welcome this support and encouraging us to have more resources to be able to help you. Now, I would like to give the floor to Dr. Jim Campbell, which is the Director of Health Workforce in WHO headquarters.
Thank you very much, Lewis. Chair, Acting Regional Director, Ministers, Delegates, colleagues, ladies and gentlemen, it's an absolute pleasure to join you here in Manila for this item and throughout the week to really understand some of the challenges, the issues, solutions, good practice that is coming from this region, and to hear the consensus around this particular discussion. Let me just acknowledge the work of member states, the experts, the colleagues here in the country offices and the regional office for obviously the process of building that consensus over the last 12 months. It's when I hear such strong endorsement in a regional committee or the World Health Assembly, that reflects this co-development process that has happened and come forward. And many of you have talked about the alignment with your national strategies, the alignment with regional or sub-regional strategies. We saw the colleagues from the Pacific Health Ministers meeting endorsing similar concepts just last month around some of these issues. We've heard last week the launch of the new national strategy here in the Philippines with a lot of similarities. So really it's great to see that alignment, but more importantly, not just on the workforce technical area and the science, but the alignment with the future vision, the alignment with the health security debate, the alignment with the primary healthcare consideration, non-communicable diseases and aging. All of those health outcomes or the preparedness agenda depend on the people. And without investing in the people, through their education and training and through their retention, we're not going to achieve some of that. If I may, just 4 points to either reaffirm or emphasize a couple of things that I heard from you. Stewardship. I really welcomed the delegate from the Republic of Palau, really emphasizing this is a multi-sectoral whole of government approach, that there is a competition in the global labor market and in national and regional labor markets. And we need to turn that competition into collaboration and coherence to come further forward. The strategy really in the framework puts forward some key areas, but we need to elevate the thinking to the health and the care workforce for health preparedness, for health emergencies, for climate resilience. We need to engage the public sector, the private sector, faith-based organizations, not-for-profit, for-profit private institutions, and really to drive that further forward. It is, yes, universal health coverage and the clinical services, but we also need to look at the essential public health functions, One Health, animal health, and look at a really coherent approach. Here in the Western Pacific region, private services are a greater share of the market than public services, and we have the same issue in 4 of the 6 WHO regions. So to really expand that governance and stewardship role. Secondly, action and investment. I heard multiple references to the learning from COVID-19 and the experience that we've heard, and this has been happening around the world. Inquiries into why did our health systems fail? Why did our public health systems not meet the challenge when tested? And there was a wonderful, wonderful quote from the president of the International Association of Public Health Institutions that many of your member states here are part of. And he said, show me your strategy and I'll see that you care. But show me your budget and I'll know that you care. And that really is, how do we take the consensus that you've agreed on, the framework for action, and put that into budget? And similarly, a challenge for the incoming RD-elect, how do you make sure that this is fully integrated, this consensus around the framework, how is that fully integrated into the next 5-year plan, the next 2-year plan? How can member states work with the WHO country representatives to drive that action further forward? And I was encouraged to hear that many of you talked about underpinning that with data, evidence, and science. It's the first core element that we need to do. Thirdly, and again, this is a bit of a grouping from some of the feedback, the gender equity and diversity discussions that many of you spoke to, whether that's the diversity of the workforce to represent your populations, your First Nations, your indigenous communities, to represent disability and the vulnerability, clearly an issue. Gender, we've heard many of you speak to the topic. If you look at the global statistics around the world, the health and care economy is the biggest employer of women, 67% globally, against an average in all other sectors of 41%. Here in the Western Pacific region, you're even higher than the average. You're at 71%, and that's a conversation there. And we've heard from a couple of examples of 80% and in terms of the workforce, or 75% in terms of an occupation. So really has to be part and parcel of the debate. So that gender, the equity, the diversity. Finally, if I may, on migration, mobility, and the code. Many of you, as we were taking notes, came up to this issue. Internal migration and mobility from urban to rural, this geographical space. Migration within the Pacific and mobility within the Pacific, migration within the region, migration out of the region. We sit as guests of our hosts here in the Philippines, and Secretary, one of the world's largest engagement strategies around nursing workforce migration. And we thank you, and the federal states of Micronesia paid recognition to that support and solidarity from yourselves. We do need a new debate on migration. The International Code of Practice was adopted in 2010, but in the last 3 years since COVID-19, we've seen the most rapid acceleration in migration and mobility since records were ever captured. We're seeing 30–40% increase in medical migration, and upwards of 60% in nurse migration. This is the impact of which challenges our primary healthcare ambitions, our NCD ambitions. So we do need a new debate. I would absolutely welcome, and with Lewis, how to engage with you. There will be a request at the World Health Assembly for all member states to update your reporting next year, 2024. On the implementation of the Code of Practice, and that will be an opportunity to raise your voices on this issue at the regional level and at the global level. But again, thank you very much. It has really been a pleasure to engage with you all this week and to hear this consensus throughout the region on some critical topics. Thank you.
Thank you very much, Mr. Chairperson, distinguished representatives. Good morning. First of all, I would like to thank member states for your continued commitments to strengthening health systems and the health workforce in the Western Pacific region. With the Global Strategy on Human Resources for Health, Workforce 2023, and the new regional framework, and the commitment and leadership of the government, a strong and resilient health workforce can be built. Earlier, I referred to gaps in the health workforce and the emerging issues that the Western Pacific region faces. This new regional framework lays out innovative approaches to guide member states to meet those health workforce challenges. Our actions must keep pace with the evolving health needs of the population. We must take a people-centered and primary healthcare-oriented approach to achieve the health-related targets of the Sustainable Development Goals. The region cannot have a healthier and safer population with fragile health systems. And strong health systems cannot be built with a health workforce that is deficient in numbers, skills, and motivation. Enabling regulation and legislation should support the process of building a competent and motivated health workforce and strengthening the health systems. Together, we must invest in and protect the health workforce. This will result in well-distributed employment opportunities, boost local economies, accelerate social progress, and contribute to gender equity and human rights. The new regional framework to shape a health workforce for the future of the Western Pacific will guide WHO member states and partners in their collective efforts to build a well-performing and resilient health workforce as we work together to continue to take steps to improve the health and safety of everyone in the Western Pacific region. And finally, ladies and gentlemen, let me thank to Dr. James Campbell for his presence here. Thank you, Jim, for coming and being part of this discussion. And I'd like to thank him also for his strong leadership at the global level, which I followed with my other hats in headquarters. And as this is such an important issue for this region, I would like to ask him and encourage him to work with us and to support us and to consider this region as your adopted child. Thank you. Back to you, Chair.
Thank you, Dr. Jacob and the Secretary. If there are no further comments, may I request the rapporteurs to draft an appropriate resolution. It is now time for a coffee break. The plenary session will reconvene in 15 minutes at 10:55 hours.
Adopted child.
Thank you very much. You have the floor.
Thank you very much, Chair, distinguished representatives. I am pleased to introduce agenda item 15, which is outlined in document WEPRO RC 74/9. It presents progress reports under the 4 thematic priorities of the For the Future vision, namely health security, including COVID-19, antimicrobial resistance, non-communicable diseases and aging, climate change, the environment and health, reaching the unreached, and cross-cutting progress report advancing for the future vision. All the progress reports will be considered together, as the chair has pointed out. I would now like to invite the technical directors leading the work under these areas to present these reports, these progress reports, starting with health security, including COVID-19 and the antimicrobial resistance. I would like to invite now Dr. Babatunde Olowokur, Regional Emergency Director and Director of the Division of Health Security and Emergencies, to introduce the progress report on health security, including COVID and AMR. Over to you, Babatunde.
Thank you, Susanna. Mr. Chairperson, distinguished representatives, I am pleased to present for your consideration document WPR/RC74/15, Progress Report on Health Security, including COVID-19 and antimicrobial resistance in the Western Pacific region. Over the past year, the countries and areas of the Western Pacific have continued to respond to COVID-19 and Mpox, alongside other concurrent events that have threatened the health and well-being of the region's people. Recently, the region has experienced multiple typhoons, devastating flooding, and new outbreaks, sometimes linked to these disasters. The climate crisis affects the region disproportionately, necessitating an approach of continuous learning and improving to protect populations from concurrent and compounding threats, while leveraging solidarity and critical partnerships both nationally and regionally. Antimicrobial resistance continues to threaten the lives of millions of people across the region. Strong, coordinated, multi-sectoral action is critical to combat AMR, as well as to address food safety risks and strengthen One Health actions. The proposed Asia-Pacific Health Security Action Framework calls on whole of government and whole of society stakeholders to continue to support prevention, preparedness, readiness, response, and resilience in relation to multi-hazard public health emergencies, taking a One Health approach. The Regional Committee is invited to consider the progress made on health security, including on COVID-19 and AMR. Thank you, Mr. Chairperson.
Thank you very much, Babatunde. I would now like to invite Dr. Hiromasha Okayasu, Director of the Division of Healthy Environments and Population, to introduce the progress reports on non-communicable diseases and aging, and climate change, the environment and health. Hiro, over to you.
Thank you very much, Acting RD. I am glad to present a report on non-communicable diseases and aging. NCD is a very significant concern in this region, which causes 87% of deaths in the Western Pacific. This year's report emphasizes the regional action framework on NCDs and promoting healthy environments and the regional action plan on healthy aging. NCD regional action framework promotes a shift from disease-focused sick system to an overall health and well-being, which we call the health system. WHO offers the tailored support to member states for NCD control, prevention, and particular emphasis on data for policy. Collaboration spans various sectors to regulate tobacco, alcohol, and unhealthy food. And we also adapted innovative strategies such as digital networks, and for instance, the Cambodia's Digital Tobacco Cessation Initiative. And schools also play a significant role for NCD prevention and control. And WHO supports the evidence-based guideline for healthier school environments and community engagement, which enhances the health promotion in schools. Healthy aging benefits all of us, not just the older people in future. WHO promotes the awareness, community care, and technological innovation related to healthy aging.
And we are also actively collaborating with academia, focused on multi-sectoral action for healthy aging, emphasizing the social determinants of action. The regional committee is invited to note the progress on implementation of the for the future thematic priorities on NCD and aging. Thank you very much.
Thank you very much, Hiro. I would now like to invite Dr. Rajendra Prasad Hubrai Yadav, Acting Director, Division of Programs for Disease Control, to introduce the progress report on reaching the unreached. Raj, you have the floor.
It is an honor to present the progress report on the thematic priority of reaching the unreached, which is one of the 4 thematic areas, priorities of the For the Future vision document. In 2022, the Regional Committee endorsed the Regional Framework for Reaching the Unreached in Western Pacific Region 2022-2030, making a collective commitment to ensuring equitable and inclusive health access for everyone in the region. The progress detailed in the report is a testament to the combined efforts of member states, WHO, and partners in reinforcing essential health services to reach the unreached, which is aligned to the primary health care. The Regional Committee is requested to note the progress in the implementation of the For the Future thematic priority on reaching the unreached. Thank you.
Thank you very much, Raj. Finally, I would like to hand over to Dr. Kidong Park, Director, Data, Strategy and Innovation, to introduce the progress report on 15.5, Cross-Cutting Progress Report, Advancing for the Future.
Thank you, Dr. Yakab. Mr. Chairperson, distinguished representatives, I'm pleased to share an update on implementation of the action frameworks to advance the cross-cutting priorities of the For the Future vision. The 3 action framework, universal health coverage, moving towards better health, regional action agenda on achieving the sustainable development goals in the Western Pacific region, and the regional action agenda on harnessing e-health for improved health service delivery in the Western Pacific, serve as regional guidance with the potential to transform health systems in the Western Pacific to achieve the goal of being the safest and then healthiest region. A key milestone in advancing the implementation of the UHC action framework includes the revitalization of the UHC Technical Advisory Group, which is intended to guide country actions towards a high-performing health system. Similarly, some key milestones were achieved under the Regional Action Agenda to achieve the SDGs. These included policy dialogues for sustainable financing and strengthening impact measurements on health-related SDG targets. The Regional Action Agenda on e-health is also advancing, with demonstrable support provided to selected member states, which includes the development of the National Strategy for Digital Health. A revised regional action framework for digital health is to be drafted in 2024. The Regional Committee is invited to note the progress made in advancing the For the Future vision to achieve UHC, the SDGs, and strengthening e-health for improved service delivery in the Western Pacific region. Thank you.
Thank you very much, Kidong. And then finally, let me call on Dr. Hiromasa Okayasu again to present the report on climate change and environment and health. Over to you, Hiro.
Thank you very much, Acting RD. Climate change and environmental hazards, such as air pollution, exposure to hazardous chemicals, and lack of safe water and sanitation and hygiene, pose serious threat to the health of people in our region. If not addressed, the impact of climate change and environmental hazards will pose even greater risks to the health and safety of the region's people in the future. Endorsed by the Regional Committee in 2019, For the Future, towards the healthiest and the safest region identifies the climate change, the environment, and health as a thematic priority for WHO in the Western Pacific. To realize the ambitious goal of COP26 to build climate resilient and sustainable health systems, The Alliance for Transformative Actions on Climate and Health was set up by WHO and its partners. The Alliance is an informal voluntary network through which participants can exchange views, share information, and enhance technical and political cooperation on climate change, the environment, and health. The Regional Committee is invited to consider progress on the implementation of the For the Future thematic priority on climate change, the environment, and health. Thank you very much.
Thank you very much, Director colleagues, for presenting the progress reports. And with this, I hand you back, Chair. Thank you.
Thank you. We will now hear from representatives who wish to speak on this item. Please indicate you wish to speak by clicking the big button on your microphone. Okay. I call on the representatives of Fiji to be followed by Republic of Korea.
Honorable Chairperson, Acting Regional Director, honorable members of Forum. Fiji acknowledges the Secretariat and endorses the progress reports on the region's current technical programs on health security, NCD and aging, climate change and health, reaching the unreached, and the cross-cutting issues report. We also acknowledge WHO for 3 high-level meetings held for pandemic preparedness, prevention, and response, universal health coverage, and TB, all of which are important for our region. Prosperity, development, security, and long-lasting peace cannot be gained without good health. On AMR, Fiji continues to pursue greater awareness and research with the support of our partners to deepen our understanding of AMR in human and animal health. We are also pursuing the One Health approach to AMR, working with our partners in agriculture, environment, and fisheries sector. We have launched our One Health National Action Plan on antimicrobial resistance 2022 to 2025, which will guide our forward engagement in AMR under One Health. Fiji also recently published our first ever antibiotic guideline for the animals, which will help strengthen antibiotic stewardship in the animal sector. On NCD, we recently launched the Fiji modification of the WHO PAN module, which is called the Fiji Cardiovascular Risk Assessment and Management Guideline, or the Fiji CRAM Guideline. In this year's national budget, the government announced the increase in domestic excise tax on juice, ice cream, sweet biscuits, snacks, and sugar confectionery, as well as an import excise of 15% on these items. Excise taxes on tobacco and alcohol were also increased. Fiji is looking forward to conducting its next step survey in early 2024. On climate change and health, Fiji calls on all our member states to support the high-level political declaration on climate change and health that will be endorsed at the COP28 health event in December 2023. This will help our ongoing effort to mainstream climate change and health matters into future global, regional, and national deliberations on climate change. To conclude, Fiji fully embraces the UHC ideals to reach the unreached and achieve universal coverage for our population. Through our new primary healthcare approach, we intend to strengthen our pragmatic responses to the rising tide of TB and HIV in the country through a comprehensive community-based approach. We call on WHO and our health partners to assist Fiji in implementing our PHC plans and program to achieve our set goals. I thank you.
Thank you. I call on representatives of Republic of Korea to be followed by Singapore.
Thank you, Chair and Acting RD, distinguished delegates, ladies and gentlemen. The Republic of Korea highly appreciates the efforts to make progress on different technical programs made by the WHO WIPRO Secretariat, member states, and other partners. Agreeing that antimicrobial resistance is one of future health security threats, Korea has established and implemented the second National Action Plan on AMR. And internationally, as one of WHO collaborating centers for AMR, Korea provides support to member states, including Mongolia, to strengthen their capacities related to glass and laboratory capacities and One Health research. Moreover, as Korea also seeks the designation of WHO Collaborating Center for Pandemic Preparedness and Response, Korea will go all out to enhance WIPRO member states' capabilities to respond to public health emergency in close collaboration with the WIPRO. With regard to NCD, Korea Disease Control and Prevention Agency, KDCA, and WIPRO jointly held a workshop for member states in the region, which was titled as Data for Policy Workshop to Strengthen NCD Prevention and Control in Korea in June 2023. At this workshop, the KDCA introduced its best practices, such as the Korea National Health and Nutrition Examination Survey, the Korea Community Health Survey, and data-based policies to control and manage chronic diseases. As a follow-up measure, Korea suggested the development of training programs for chronic disease survey and pledges to ensure that Korean experts will actively engage in the training program. As for climate resilience, taking note of the result of the meeting of the Technical Advisory Group on Climate Change, the Health, Environment and Health, which was held in Korea in September 22, Korea supports measures taken by WIPRO and member states under the 4 pillars. In this regard, as providing the water sanitation and hygiene, wash in healthcare facilities, is set as a starting point toward a climate resilient healthcare system. Korea, together with WHO Country Office in the Philippines and the BOH Philippines, has been strengthening capacities to reduce healthcare-associated infections and carrying out other related activities as part of a mid to long-term project to enhance preparedness and response to post-COVID-19 challenges from 2022 to 2026. Concerning reaching the unreached, Korea has strived to achieve global disease elimination goals targeting tuberculosis, AIDS, hepatitis, malaria, dengue, and among others by creating a management system that encompasses a whole process ranging from prevention, screening, to treatment. Furthermore, Korea will endeavor to maintain close collaboration with the international community by sharing its experience to control and manage diseases that afflict the unreached, and also work hard to contribute to achieving the global goals by implementing regional frameworks. Meanwhile, Korea expresses concern about the following situations: a rise in maternal mortality and malaria incidence, and a fall in DPT-3 immunization coverage, and the increased percentage of people whose out-of-pocket health spending exceeds 10% of their household's budget. Korea expects the regional office to provide assistance for member states to devise improvement measures to guarantee universal health coverage. Korea hopes that this regional committee meeting will serve as an opportunity to enhance multilateral cooperation for the WIPRO Secretariat and member states to take joint actions for dealing with the aforementioned priorities. Korea will spare no effort to cooperate. Thank you.
Thank you. I call on representatives of Singapore to be followed by Japan.
Thank you, Chair. Singapore thanks WIPRO for its continued support of member states through its technical programs which comprehensively address all facets of health and healthcare. Singapore's intervention will be specific to item 15.1 and 15.2. On 15.1, allow me to share 2 points. First, on the strengthening of health security. Following Singapore's white paper on COVID-19, we are setting up a new communicable diseases agency to provide an integrated approach towards the management of complex health emergencies. Through this new agency, we hope to foster strong collaboration with member states to better prepare against future global health threats. Second, on the need for increased focus on AMR, Singapore recognizes the urgent need to address AMR through responsible antimicrobial use, surveillance, and research. We have accordingly taken a One Health approach in combating AMR through our National Strategic Action Plan on AMR. It is prudent to build on the framework for accelerating action to fight antimicrobial resistance in the Western Pacific and increase regional collaboration for AMR surveillance and control, facilitating information sharing on resistant pathogens and strategies to promote prudent antimicrobial use. Through combined efforts, we can preserve the effectiveness of existing treatments and ensure access to essential antibiotics for all. For 15.2, allow me to share 2 points. First, on the prevention and management of NCDs, Singapore is committed to its emphasis on preventive care, including screening and vaccinations, and this is reflected in our Healthier SG initiative, which seeks to enroll all residents with a family doctor as a first line of care. Through these preventive efforts and encouraging healthy living and physical activity, we aim to provide holistic management for our population's non-communicable diseases and ensure better compliance and control. Second, on aging. Singapore has recently launched a refreshed action plan for successful aging this year, which adopts a life course approach to promote healthy aging. It includes upstream prevention to inculcate healthy habits through national programs to keep Singaporeans as healthy as possible for as long as possible. Seniors are empowered to take charge of their physical and mental well-being through active aging programs and care services. We also create age-friendly environments to support seniors to age in place while staying connected to their loved ones and society through digital platforms and support networks. Singapore is committed to closely working with the regional office and fellow member states to enhance our collective capacity to respond effectively to current health concerns and future pandemics. Thank you.
Thank you. I call on representative of Japan to be followed by Australia.
Thank you, Mr. Chair. Japan appreciates the Secretary for its efforts of preparing progress reports on technical progress. We would like to comment especially to 15.2, 3, and 4. Regarding aging and the NCDs, we believe that to prevent non-communicable diseases, education is important to change lifestyle. In Japan, particularly, school health plays a significant role in forming the lifestyle for children and adolescents. We would like to highlight the importance of oral health for healthy future generations, as well as healthy aging. Japan has been promoting health in the context of achieving universal health coverage. We would like to actively contribute to resolve various issues related to oral health by sharing our experience and the knowledge. Regarding the climate change and environmental degradation have already impacted on the human health in the Western Pacific region. Japan has already been experiencing increasing health hazards due to extreme temperature, and Japan recognizes the fact that many island countries in the Western Pacific region have already experienced strong cyclones and increasing seawater inflow into freshwater aquifers in parts of the coastal areas through sea level rise due to climate change. We hope that the UPRO Secretariat will continue its efforts to collect scientific evidence on the impact of climate change and environmental degradation on health, and further accelerate measures against climate change and environmental degradation in our region based on the global strategy and the regional framework. Finally, I would like to touch upon reaching the unreached. Japan would like to appreciate all the efforts made by UPRO for tackling infectious diseases in our region. We also appreciate the UPRO for advancing its activities with leaving no one behind, specifying 5 action domains in harmonization of the existing regional and global framework. We would like to stress the importance of working on the cross-cutting challenges beyond the health sectors, such as gender equity and planetary health, for putting this agenda forward. I thank you.
Thank you. I call on representative of Australia to be followed by Malaysia.
Thank you, Chair. And thank you very much to the Secretariat for the updates on technical programs in the region. Australia is very pleased to actively support the Western Pacific region in the area of health security through our thematic funding for WHO's emergency program and through our EMT capability, the Australian Medical Assistance Team, AUSMAT. Since January 2019, AUSMAT has deployed on 22 missions within the region. Australia is further strengthening the capacity of national health and emergency workforces and EMTs in the Pacific through a new phase of the National Critical Care and Trauma Response Centre Regional Engagement Program. On One Health, we're very pleased that One Health coordination and advocacy has progressed in the region. We see strengthening the One Health approach as an important pillar of the new pandemic accord as a basis for health emergency prevention into the future. Australia commends WHO's efforts on antimicrobial resistance. We're very concerned by the projections of drug-resistant bacterial infections affecting 5.2 million people in the Western Pacific region between 2020 and 2030. Australia will continue to play our part in tackling AMR and will provide 75 million Australian dollars for product development partnerships to develop new drugs and diagnostics under our Partnerships for a Healthy Region initiative. On NCDs and ageing, we note the Western Pacific region is experiencing a surge in NCDs, which are the leading cause of death and disability in the region. We reiterate our commitment to WHO's work on NCDs, and we support in particular the work on promoting tobacco control in the region, recognising tobacco, including use of e-cigarettes, is a serious challenge to ongoing efforts to prevent NCDs. We also recognise the importance of promoting the mental, social and physical health and wellbeing of older people. We commend WHO's work on the Reaching the Unreached framework and encourage further efforts and more detailed reporting on how women and girls in all their diversity, people with disabilities, Indigenous peoples and ethnic minorities are being consulted and engaged with WHO's work. And we welcome further detail on how WHO is supporting information sharing in the region with respect to data tools, systems and approaches to redress health inequities. Thank you.
Thank you. I call on representative of Malaysia to be followed by Philippines.
Thank you, Mr. Chair. Distinguished delegates, ladies and gentlemen, Malaysia appreciates the comprehensive progress report, notes the issues faced in the region and the great work done by our WHO colleagues and partners in supporting member states within the 5 technical programs. Antimicrobial resistance, or AMR, is a critical global health security challenge requiring a united response. Hence, we pledged our unwavering support in tackling the growing issues of AMR. The recent WIPRO mission to Malaysia for capacity building support in AMR outbreak response within hospital settings was timely and appreciated. To address the surge of NCDs, the National Health Screening Initiative has been implemented to detect risk factors and NCDs diseases at early stage, facilitate early treatment, and reduce significant complications. Taking account of WHO's integrated care of older persons framework, Malaysia is transitioning from predominantly institutional care to a more holistic and community-based integrated care model to serve the elderly population. Malaysia has committed to achieving the carbon neutrality target by 2050. To contribute to this goal, the Ministry of Health Malaysia has also embarked on sustainable programs such as green hospitals and clinics, energy saving and 3Rs initiatives to reduce, reuse, and recycle waste in all healthcare facilities that aim to reduce carbon emissions and minimize the impact on climate change. Malaysia continues efforts to reach people in vulnerable and at-risk groups. To further improve the coverage of hepatitis C, Malaysia has piloted hepatitis C screening and treatment program for prisoners in January 2020, which has seen 17% prisoners identified to be hepatitis C positive. As of the end of December 2022, HCV screening and treatment in prison was expanded to 19 facilities. Mobile health services comprising immunization, treatment of minor illnesses, outpatient services, and emergency care are widely dispensed to remote areas as well as to marginalized groups. In conclusion, Malaysia will stay committed to all the technical programs to ensure the good health for all our people, embracing the true spirit of universal health coverage, leaving no one behind. Thank you.
Thank you. I call on the representative of Philippines to be followed by Vietnam.
Thank you, Chair. We are grateful for progress reports on the implementation of technical programs in that it considered initiatives with the Philippines. We value WHO's subnational interventions, community-based healthcare services, infrastructure, and resources, foster long-term partnerships with local organizations. This trigger greater alignment and investment in primary healthcare through direct funding, technical assistance, and capacity building. The severity of climate change-related disasters, geopolitical tensions, and technological innovations makes the global environment more volatile, uncertain, complex, and dynamic. It is necessary to strengthen and mainstream WHO's invaluable assistance on strategic foresight across all technical programs. Member states must prepare for plausible future scenarios and effectively scan future trends and drivers of change that can impact the future of health in the region. Finally, combining the cross-regional and cross-country collaborations in the report on WHO's work in countries and the reports on implementation of technical programs provides an excellent vantage point to assess our journey together for the future towards the healthiest and safest region. Thank you.
Thank you. I now call on representative of Vietnam.
Thank you, Chair. I'm pleased to make an intervention on behalf of the government of Vietnam on the progress reports on 4 technical programs. Let me start with the health security. Recognizing the threats of AMR, Vietnam had a multi-sectoral national action plan on AMR, and in September this year, the Prime Minister approved the national strategy for AMR for 2023 to 2030. We understand that the global and regional guidance would be helpful in further development AMR programs in Vietnam and other countries. Turning to COVID-19 now, Vietnam is proactively improving treatment capacity and undertaking genetic sequencing. The second topic is NCDs, which account for nearly 80% of total deaths in Vietnam. Under our national strategy, program and action plan, we are following WHO's recommendation to strengthen tobacco and alcohol control, promote healthy nutrition and physical activity, and expand prevention, early detection, and management of NCDs. We note that the report on NCD and aging. The third topic is climate change, the environment, and health. Vietnam is highly vulnerable to climate change, so adaptation and mitigation are government priority. Several strategies and action plans will help us achieve our pledge to reach net zero carbon emission by 2050, including the health sector action plan on climate change. With WHO, we have been developing a models for climate resilience and environmentally sustainable healthcare facilities and communities, so we can scale up those models throughout the country. We are now working with WHO and UNDP to develop a proposal on climate resilience and low carbon sustainable healthcare to mobilize the Green Climate Fund support. Vietnam registered to join the Attack on Climate Change and Health, and Vietnam is one of 4 country members of Attack in WIPO. The Ministry of Health of Vietnam is also planning an international conference on climate change and health in the end of the 2024 in Vietnam. We will bring national and international expert, policymakers, and stakeholders together to help address pressing climate change and health challenges. We take this opportunity to kindly invite WHO to be a co-organizer and request the WHO regional office to provide speaker, technical, and financial support to ensure the success of this important event. Finally, Vietnam is making great efforts to reach the unreached and ensure equitable access to healthcare service. Challenges remains particular due to the geographical barriers and socio-economic differences. Work to address the needs of undeserved communities, including collaboration such as with scientific institutions and disease control center and sustainable investment and public health infrastructure. We look forward to continuing the valuable relationship we have with WHO and as the international partner. Thank you, Chair.
Thank you. Respected colleagues, we will now suspend this item so that we can move to consideration of resolutions. We will resume item 15 on progress reports when we meet back here after lunch at 13:30 hours. We will now proceed to the consideration of proposed resolutions. The first proposed resolution, WPR/RC74/conference paper number 2, is on communication for health. May I call on the English repertoire to read the resolution with amendments from the draft uploaded in the web portal.
Thank you, Mr. Chair. I am pleased to present the draft resolution on communication for health. The resolution already includes any amendments suggested. In addition, the French rapporteur and I have tried to reflect any concerns expressed by member states, both in the plenary session and online, in the draft resolution. Now I will read the resolution. Communication for health. The Regional Committee, affirming the critical role of strategic communication in realizing the shared vision of WHO and member states to make the Western Pacific the healthiest and safest region, as outlined in For the Future Towards the Healthiest and Safest Region, the region's implementation plan for the WHO 13th General Program of Work 2019 to 2025, and work towards achieving the health-related targets of the Sustainable Development Goals, recalling member state support to scale up the communication for health C4H approach through the development of a regional action framework expressed during a C4H panel discussion at the October 2022 session of the Regional Committee and a side event at the October 2021 session, recognizing the seminal role of strategic communication as a tool for improving health and well-being in conjunction with other public health interventions, noting that connectivity challenges affect access to information and the ability to reach people with health communication, while the development of digital communication has created new risks, including the rapid spread of misinformation and disinformation, emphasizing also the power of the C4H approach in helping to address increasingly complex health challenges in the context of rapidly evolving communication technologies to inform and help motivate people to protect their health and that of their families and communities, convinced that C4H can contribute significantly to efforts to narrow the gap between what is known and what is done to protect health in the Western Pacific region. 1, endorses the Regional Action Framework on Communication for Health, a vision for using communication to improve public health in the Western Pacific region. 2, urges member states, 1, to use the action framework as a guide for using strategic communication to improve knowledge, change attitudes and behaviors to contribute to improved health outcomes. 2, to assess capacities and make adjustments and investments to facilitate implementation of the C4H approach according to national and local context. 3, to ensure sufficient resources are mobilized to scale up C4H and to measure, evaluate, and share results for continuous improvement. 3, request the regional director 1, to provide technical support at regional and country levels for implementation of the action framework. 2, to support adoption and scaling up of the C4H approach through dissemination of the action framework and other tools and guidance and facilitation of collaboration among stakeholders. 3, to report periodically on progress in the application of C4H and, to the extent possible, its contribution to health outcomes in the Western Pacific region. Thank you, Mr. Chair.
Thank you. Are there any other proposed amendments? Please indicate you wish to speak by clicking the big button on your microphone. Does the committee agree? She's sabotaging. Does the committee agree to the proposals for amendments for the draft resolution? If there are no further comments, the draft resolutions as amended is adopted. The next proposed resolution, WPR/RC74/conference paper number 3, is on health innovation. May I call on the English rapporteur to read the resolution with amendments from the draft uploaded in the web portal.
Thank you, Mr. Chair. I am pleased to present the draft resolution on health innovation. As in the previous resolutions, any amendments suggested have already been incorporated into the resolution. In addition, the French rapporteur and I have reflected any concerns expressed by member states in the plenary in the draft resolution. Now I will read the resolution. Health innovation. The Regional Committee, recalling the WHO 13th General Program of Work, 2019 to 2025, priority to harness the power of innovation as a critical enabler to achieving its triple billion targets. Recalling also the 2023 final report of the WHO Council on the Economics of Health for All, transforming economies to deliver what matters, calling for the development of a new health innovation ecosystem that prioritizes the common good over short-term market profits to serve the health needs of all the world's people, especially those in low and middle income countries. Noting the operational shift, highlighting innovation, finding new approaches to meet future challenges. For the future towards the healthiest and safest region, the Western Pacific region's implementation plan for the WHO 13th General Program of Work, recognizing that effective implementation and scaling up of health innovation for population impact necessitates public sector leadership to create supportive mechanisms because health innovation is a complex process requiring an enabling environment, collective intelligence, values, and direction. Recognizing also the clear benefits of a regional approach that fosters cooperation, knowledge sharing, and enabling ecosystems to bridge health disparities within and between countries and areas. 1, endorses the Regional Health Innovation Strategy for the Western Pacific. 2, urges member states, One, to adapt the objectives and actions of the regional strategies to their unique contexts to ensure effective implementation. Two, to foster cross-societal collaboration for health innovation at international, national, subnational, and community levels. Three, to ensure adequate resources are available to implement the regional strategy. Three, request the regional director. One, to provide technical support for member states to adapt and implement the regional strategy at national and subnational levels. Two, to disseminate the regional strategy and facilitate collaboration among stakeholders to support its implementation. Three, to report periodically on progress in health innovation in the Western Pacific region. Thank you, Mr. Chair.
Thank you. Are there any other proposed amendments? If there are no further comments, the draft resolution as amended is adopted. Number 4. The next proposed resolution, WPR/RC74/conference paper number 4, is on health workforce. May I call on the English rapporteur to read the resolution with amendments from the draft uploaded in the web portal.
Thank you, Mr. Chair. I am pleased to present the draft resolution on health workforce. Again, the resolution already incorporates any amendments suggested and concerns expressed by member states in the plenary. Now I'll read the resolution. Health workforce. The regional committee, recalling commitments to strengthen the health workforce made by the regional committee in 2006 WPR/RC57.R7 and 2017 WPR/RC68.R7 and the World Health Assembly in 2022 WHA 75.17. Affirming that a well-performing health workforce is central to strong and resilient health systems and is essential to make progress towards universal health coverage, the Sustainable Development Goals, and the Western Pacific's vision for health presented in For the Future towards the healthiest and safest region. Deeply concerned that critical vulnerabilities remain in health workforce numbers, distribution, quality, and protection, adversely affecting the delivery of essential services to meet the changing health needs of populations in the region. Recognizing the need to move towards a primary health care-oriented approach to develop, attract, recruit, and retain a health workforce that ensures people-centered services. One, endorses the regional framework to shape a health workforce for the future of the Western Pacific. Two, urges member states, one, to use the regional framework as a guide to strengthening their health workforce according to their context and capacity and tailored to their needs and priorities. Two, to foster high-level commitment and intersectoral collaboration among government agencies and other stakeholders in support of a coordinated approach around strengthening the health workforce at all levels. Three, to strategically invest adequate resources for strengthening the health workforce. Three, request the regional director, one, to provide technical support for member states to develop and implement national policies and plans in line with the regional framework. Two, to facilitate collaboration and sharing of knowledge, experiences, lessons, and innovations to address health workforce challenges in member states. Three, to report periodically on progress in the implementation of the regional framework to shape a health workforce for the future of the Western Pacific. Thank you, Mr. Chair.
Thank you. Are there any other proposed amendments? If there are no further comments, the draft resolution as amended is adopted. Ladies and gentlemen, now we will break for lunch and meet here again at 13:30 hours. Thank you.